Most strength training programs that have been tried in multiple sclerosis are pretty mild to moderate in nature. There's a thought perhaps that you don't want to work patients with MS too hard or too aggressively. And as a result, most of the strength training programs that have been tried in multiple sclerosis have been relatively mild to moderate in their intensity. Recent research by Finland has shown that patients with MS can tolerate, their relatively high weight training loads, but he did not look at their functional outcomes after the maximal strength training. In this study that I did with my students at Hunter, we did a similar strength training protocol that was done by Finland, but we looked at measures of mobility when we were done, particularly the 6-minute walk test and the Berg balance scale. It was 5 women and 2 men with mild to moderate disability, anywhere from about a 2 to a 5.0 on the expanded disability status scale. And all of them have had experience with physical therapy or with some type of training program. But during this period of time, they were told to undergo no other type of training. So the improvements we could really only attribute to the strength training. All of them had some strength training in the past, but with much, much lighter weights. But part of the conditions of the study was to tell these patients that there could be no other type of training, either strength training, mobility training, just their normal daily activities. The age range was, I believe, 30 to 56. So we had a pretty wide range, both genders, ages, degree of disability, and that's going to be pretty normal for multiple sclerosis. This is a very heterogeneous population. It makes studying the population somewhat difficult. But on the flip side, if you get a good treatment effect for a diverse set of patients, it indicates that this is a treatment that could work really somewhat globally for MS patients. Though this was entirely a leg press, we did unilateral leg press. The patient was seated in a leg press. They did 4 sets of 4 repetitions, 1 leg at a time, 85 to 90% of their 1 repetition max. So it was a very high load, and it was a twice-a-week training program for 8 weeks. That was a concern, but we had no adverse effects as we went. The patients tolerated it very well. There was 1 dropout for an unrelated cause. But similarly, as was in the study I just mentioned, there were no adverse effects. The patients tolerated it quite well. We supervised them very carefully while they did this, and most of the patients actually were very enthusiastic about the program. They might have to take breaks along the way because we kept increasing the load they were lifting over time. So I would be more concerned, because they are lifting heavy weights, that there could be the potential, particularly in older patients, for damage to occur. And I think with any training program, especially aggressive training program, you would have to give them breaks along the way, and maybe have them strength train aggressively for 3 months, then take a few weeks off to recover, then resume. They not only improved significantly in their balance, as evidenced by a significant improvement in their Berg balance scale score, they improved in their 6-minute walk test, as evident also significantly. They improved in the strength of their left and right legs, and there were no adverse effects. There was no increase in fatigue, as measured by both the visual analog fatigue scale and the fatigue severity scale. So it was remarkably well tolerated, and the patients themselves were extremely happy with the study because they did not expect they'd be able to lift such heavy weights. Not only did they all become quite pleased at how much stronger they were by the end of the study, but several of them continued with the training after the study because they were so pleased not just with the improvements in their mobility, but how much stronger they were. I would caution against that. This was a very supervised intervention, and so I would not think a patient, unless they had a lot of experience in lifting prior to their diagnosis, that they would do that. I would rather they get on a program like this supervised by a therapist at first. So as I said, 2 of the patients in the program have continued on with the maximal strength training, but this is after we'd already trained them on it for 8 weeks, and then we gave them a program to follow afterwards. Well, we recently received a grant, again from Hunter College, to do a larger scale study. We're going to have a larger sample. The sample this time was only 7. We're hoping to recruit about 30 to 40 patients for this study. We're going to not just do leg press, but also do plantar flexion and knee flexion as well. We're going to use a greater battery of tests, more detailed tests of mobility. And we're also going to include some measures of central nervous system involvement, perhaps twitch interpolation, to see if, in addition to getting improvement in the mobility tasks, that there's also evidence of increased central nervous system activation. Part of what this study has to overcome is this presumption, as you yourself remarked, this seems very, very intensive for patients with a progressive neurologic condition. But our study, at least with our small sample, seemed to indicate that this is very, very well tolerated. And I think the larger picture here may be that these patients can probably tolerate quite a bit more work than we anticipated. The original idea from many years ago was these patients should not be worked hard. It was thought that perhaps if we work these patients too hard, we could lead to an exacerbation. That idea has been completely debunked. But at the same time, there's a little bit of reluctance, I think, on the part of physical therapists to push their patients too hard. Well, you can't push the patients too much harder than we just did. And not only did they tolerate it well, but they got some pretty impressive improvements. So hopefully this might change the field a little bit about how therapists think about how they could treat their patients with MS.